Physiotherapy of Carpal tunnel syndrome. Carpal tunnel syndrome is a common condition that causes pain, numbness, and tingling in the hands and arms. The condition occurs when one of the major nerves to the hand, the median nerve, is squeezed or compressed as it travels through the wrist. There are few signs and symptoms of carpal tunnel syndrome, which are pain, tingling, numbness, and also burning sensation at the area of thumb and finger, specifically near index, middle, and ring. This is due to the pressure on median nerve. What causes carpal tunnel syndrome? The pain in your carpal tunnel is due to the excess pressure in your wrist and on the median nerve. The most common cause of this inflammation is an underlying medical condition that causes swelling in the wrist and sometimes obstructing the blood flow. Some of the most frequent conditions linked with carpal tunnel syndrome are genetic disorders, pregnancy, obesity, oral contraceptives, hypothyroidism, arthritis, and diabetes. Carpal tunnel syndrome can be made worse if the wrist is overflexed repeatedly. Repeated motion of the wrist exacerbates the muscles, which contributes to swelling and compression of the median nerve. Complications of carpal tunnel syndrome are uncommon, but they include atrophy and weakness of the muscles at the base of the thumb in the palm of the hand. This can lead to lack of dexterity of the affected fingers. There are two diagnostic tests for carpal tunnel syndrome, which are Phelan's test and Tinel's test. Phelan's test. The doctor flexes patient's wrist manually and holds together for 1 minute. Positive test elicits tingling in thumb, index, middle finger, and lateral half of the ring finger. As for Tinel's test, the doctor presses down or taps along the median nerve at inside of the patient's wrist to see if it causes any numbness or tingling in the fingers. What instruments are used to assess carpal tunnel syndrome patients? There are hand dynamometer, goniometer, and also pinch gauge. Here is a box which contains hand grip dynamometer, pinch gauge, and also goniometer. The purpose of using a hand dynamometer is to measure the maximum isometric strength of the hand and forearm muscles. The hand dynamometer can be adjusted for hand size and must be calibrated regularly for consistent results. This is a pinch gauge. This device is designed to measure pinch strength, specifically the isometric tip, key, and palmar pinch strength of the affected hand. This is a goniometer, which is an instrument to measure the range of motion joint angles of the wrist. How to treat carpal tunnel syndrome? There are three main treatments from the physiotherapy aspect, which are transcutaneous electrical nerve stimulation, TENS, ultrasound, and also massage, specifically thumb kneading and effleurage. This treatment is called the transcutaneous electrical nerve stimulation, or TENS. The TENS machine contains a small battery-operated device with one single electrode on each sticky pads. The TENS sticky pads are placed on the affected area of the wrist and hand. As the physiotherapist switches on the device, the patient will feel a tingling sensation due to the electrical current flowing through the skin. TENS is used to reduce pain. This is the ultrasound electrotherapy machine. The physiotherapist sets up the device specifically to treat carpal tunnel syndrome under the neurogenic lesions. This therapeutic ultrasound involves applying a round-headed instrument, which is called the transducer probe, to the skin at the painful area. It delivers sound waves, that can help to relieve pain and lessen the disabilities of the hand. Another treatment for carpal tunnel syndrome is massaging. This is effleurage, which is a light stroking massage, particularly to relax and soothe the patient's muscle using the palm of the hand. Whereas thumb kneading, it involves small circular movements using the pad of the thumb and pressure is applied in upwards motion. The massage is to reduce swelling of the tendons, which had caused the blockage underneath the transverse carpal ligament. Both techniques are focusing on the spasm and tightness of the muscles. What are the exercises to improve carpal tunnel syndrome? There are tendon gliding, exercises using therapy, and also stress ball. Tendon gliding exercise. This exercise is to allow each tendon to reach its greatest amount of movement. There are 5 steps shown, which are fingers out straight, make a hook fist, make a tabletop position, make a straight fist, and make a full fist. This procedure is done 3 to 5 times in a session, thrice daily. Therapy is a silicone material that can be used for a variety of hand exercises. This material is available in color-coded, graded levels of resistance. This material can be squeezed together, pulled apart, and looped over the finger to address any weaknesses that can be identified by the physiotherapist. As you can see over here, the patient is now doing finger flexion, finger extension, finger abduction, and also finger adduction. Apart from therapy, stress ball can also be used as one of the exercises for carpal tunnel syndrome. Restore Hand Therapy Kit prevents hand stiffness, increases flexibility and relieves joint pain. This kit includes 3 stress balls with varying resistance. They are soft, medium and firm to fit an individual's gripping capacity. It is mainly used as a comprehensive hand therapy for people suffering from carpal tunnel syndrome. There are 2 equipments used to support the wrist, which are splint and rock tapes. Splint. Wearing a brace or splint at night will keep the patient from bending his or her wrist while sleeping. Keeping the wrist in a straight or neutral position reduces pressure on the nerve in the carpal tunnel. It is recommended to wear the splint every day as some of the activities can aggravate the symptoms. Rock tapes. When rock tape is applied to the skin, it has a microscopic lifting effect underneath the skin and between the many layers. This allows the byproducts created by inflammation to be removed more quickly. Some preventive measures include: use minimum force while performing your task, take regular breaks and stretch your wrists, keep the keyboard at elbow height or slightly lower, try taking adequate rest from the computer at frequent intervals. Neck, back, and carpal tunnel syndrome are among the most common workplace injuries. Therefore, it is essential for us to detect carpal tunnel syndrome early before it affects our daily activities.